Joining us now from Waterloo, from Wilfrid Laurier University and their International Migration Research Center, we have Jenna Hennebry, an associate professor at Laurier. Welcome, Jenna. Jenna, you are involved in some research and in a new website that promotes, I guess, health amongst migrant workers. Can you tell us a little bit about how COVID-19 is affecting the migrant worker population in Ontario?
We've started a new website, migrantworker.ca, because we're trying to raise awareness, but also get information out to migrant agricultural workers. There's already nearly 700 migrant agricultural workers who've become infected with COVID. And this is in part due to crowded housing, difficulty in being able to adhere to physical distancing, and challenges in accessing healthcare.
When we had the outbreak down here in Niagara at the one farm, I think a lot of us were shocked that there were no PPE guidelines in effect at the farms.
Yeah, it's quite variable is what's happened across different public health units. There's been different kinds of advice given to employers. They've been given some financial support to be able to address kind of quarantine modifications. But in terms of, for example, providing masks to all employees throughout the season, that's not been a directive that's been given in most areas.
Is that something that you would recommend? Because they are working at close quarters and they're living in close quarters as well.
It's not possible to do physical distancing, right? When you're working close together in the field, when you're in housing that, even though it might, you might be sleeping in housing that's, you're making sure you have beds that are separate, for example, you still have shared kitchen areas, you have shared and communal areas, bathrooms. You need masks in those situations.
There have been a couple of deaths as well from COVID-19 amongst the migrant worker population. Where did that take place, and what is being done to make sure that that doesn't happen again?
Extremely tragic that these two deaths have taken place in Ontario. Rogelio Bonifacio were two Mexican migrant workers in the province, and in both of their situations, their deaths, and we have claimed this and will continue to contend this, were avoidable. At the very least, they could have had much better care and connection with care facilities. One of the challenges that each of them faced was being able to get adequate and rapid medical care when symptoms progressed. And in part, that's because of fear. The Mexican government, as well as a number of medical practitioners and ourselves in our group of our migrant expert working group, we have called for a coroner's inquest into those deaths. If this happens, it will be the first coroner's inquest, to my knowledge, in the province.
Some disturbing news, I think, out of Windsor, Essex County yesterday. They had set up a testing center specifically for migrant workers, and officials there are saying that they can't afford to keep it running.
With migrant workers living and working in very crowded and vulnerable workplaces, or workplaces that heighten their vulnerability, rather, testing needs to be ongoing. It can't just be in this moment of heightened concern. It's going to be, in the middle of August when this is still important.
Is it your opinion then that all migrant workers should be tested?
And here's the thing. Most migrant workers arrive in Canada healthy. They have been screened prior to leaving the country of origin that they've come from, particularly if they've come from Mexico or the Caribbean under the seasonal agricultural worker program. And so it's their conditions and their exposures here that are putting them at risk. And so while, yes, I advocate for testing, absolutely. It's important that the message that isn't sent is we're testing these migrant workers because they are a risk, but instead that they are at risk.
In your experience, do you feel that most farmers do treat their migrant workers well and are concerned with their health? It's just a few that maybe don't take the steps necessary?
So I have been doing work in this area since 2001. And I have heard the bad apples argument over and over and over again, that there's a handful of bad apples. Fair enough. But it's the structures of the program and the way in which that we are not creating possibilities for even the great employers to do more for their workers. The minimum standards are too low, the expectations are too low, and the loopholes are too great. So outside of Employment Standards Act, outside of a lot of Occupational Health Safety Act provisions, That's where migrant farm workers fall, and that's the loophole. And it doesn't matter how many good farmers you got, that's still creating a system that creates vulnerabilities for the majority.
What will it take to make those changes take place?
It's going to take a very significant hard look at the program, and a program that we have been calling for changes in for over the last 2 decades. The Mexican government and the Caribbean governments that are involved need to step up, have more conversations with the Canadian government, and come to a discussion that brings in the voices of migrant workers themselves, because they know best what the situations are that put them at risk on farms.
And there's no denying that the work that they do is essential to our industry here in Niagara and across the province. Thank you for your time today, Jenna, and keep up the fight.